it going?
I'm Ryan Payne, a Practice Support Program Coordinator. I met Lily about 3-4 years ago. She was a student in one of our group medical visits modules, and she did so well and I had such a positive experience with the module that I approached her and asked her if she would help me spin it out and teach it to her peers in other communities and try and spread the positive changes that she'd made in her practice.
I'm Dr. Lily Nasseri, and I'm a full-service family physician. I got involved in PSP approximately 4 years ago, and it's made a huge impact in my practice, and I cannot think of another way to practice medicine now. While participating in all the PSP modules so far has allowed me to see how else I can practice medicine. The problem with family medicine is that you're a little isolated. You don't really know how other people are doing things or what other ways you can do things. So I can talk to other physicians and learn from the PSP coordinators about whatever the module is.
We want them to share in a very genuine way what they've done in their practice and why it's worked, and in some cases what parts haven't worked. That's okay. It's not a sales job. It's peer-to-peer teaching and learning.
It's just made me have a whole other view of how I can be practicing medicine to be more efficient and to be able to help more people and to actually, in the end, reach more people with limited resources. The adult mental health module really gave me the tools to be able to make positive changes, to empower patients, to teach them, and to work with them. It's been a huge difference for both patients and myself. I don't come out of those visits anymore feeling helpless or that I didn't help someone. And the number of times people come back and say, wow, thank you so much. You've saved my life. I can't even tell you.
This story we've heard many times from many physicians throughout the adult mental health module, that physicians feel like they're on their heels when a mental health problem presents and they're not sure how to approach it, where to go, where to begin, and how to offer help. I actually had a coffee with a physician practicing at a very high volume practice in Surrey, and he said this has changed my life because he now felt empowered and he felt that he could help these people. And he shared a couple of cases with me that I know that he was particularly proud of. So it was a revelation for him, in his mid to late 40s in his practice in this area.
Since having done the modules, I feel like I'm making a big difference to a lot more people. I'm having a greater impact on their day-to-day lives, and I'm leaving the office a lot happier, as are my patients.
Everything that you do day to day for me boils down to having someone say to me, this has helped me. And makes me happy to see that someone is approaching an old problem in a new way and that they feel revitalized in their profession.
Even if I'm able to help one person per day, or save 5 minutes per day, over the course of a year, I've helped an extra 300 people, and I've saved an extra, whatever 300 times 5 minutes is. I've saved a lot of time, and I've helped a lot more people.